Community problem paper on health insurance. A little bit of background information on health insurance. The Patient Protection and Affordable Care Act of 2010 was originally enacted by President Obama, and its main focus is on providing Americans with access to affordable health insurance, improving the quality care and health insurance insurance, regulating health insurance industry, and reducing healthcare spending in the U.S. Its overall focus was to make health insurance more affordable for the working class, mostly the lower middle class, and the lower class. But in most research, they're focused as low income and middle income families. Um, this act was originally enacted by President Obama on March 23rd, 2010, and since then, there was numbers taken, and in March 2015, the uninsured um, decreased by millions since 2010. So, what this shows is that the amount of people who are uninsured from 2010 to 2015 drastically decreased, which showed that there were millions of people who were able to then afford health insurance or health care, which means that this act that President Obama came up with has been proven to be successful. This is specifically a clause under the Patient Protection and Affordable Care Act. Under the act, hospitals and primary physicians would transform their practices financially, technologically, and clinically to drive better health outcomes, lower costs, and improve their methods of distribution and accessibility. For that, um, here are a few plans under the act, and all plans have a minimum benefit regardless of the cost. So, regardless of if a person is paying $20 a month or $100 a month, all plans have at least a basic form of care. You can be denied insurance based off of a pre existing medical condition. And prior to this act, it was very common for a private marketplace health insurance to not accept someone who held or had a pre-existing medical condition. This was often seen in patients with cancer or who were recently diagnosed with cancer, since especially if they had a terminal illness, or people with kidney failure because they needed dialysis, and since dialysis is it's a treatment that is normally needed about twice a week, if not more, sometimes less. But since it's a constant treatment that's needed, and patients who didn't have health insurance couldn't afford to have dialysis multiple times a week, so they would result in not accepting the treatment since they didn't have the money. Another thing under this new act is that young adults could stay on their parents' plan until 26 years of age. Recent research has shown that with the new millennial years or age, um, young adults have been shown to stay with their parents until about their mid, if not late 20s, and it's something that most individuals are required by law to have coverage or be subject to tax pay. This is something that's very important for our society now. So now health insurance is required by law per this act of 2010, and if an individual does not have health insurance, but there are some restrictions, but if an individual does not have health insurance, then he or she is subject to pay a tax since it's under law to have health insurance. However, there are some exemptions, which I'll go into later. There are some exemptions to not paying this tax. PowerPoint/presentation is focused on. So, government aid. A main type of government aid is Medicaid, and it's defined as healthcare program that assists low-income families or individuals in paying for long-term medical care and custodial care costs. In Oregon, specifically, the main government aid is the Oregon Health Plan, which is OHP. And it provides free or low cost health coverage to millions of Americans, including some low income families and children, pregnant women, the elderly, and people with disabilities. A children's health insurance program, the CHIP, and this is a branch of Medicaid, but this focuses mainly on providing health insurance for all children. It was created in 1997 to provide quality health coverage for children under 19 in families that earned too much to qualify for Medicaid, but were unable to afford coverage in the private market. Um, so in Oregon, the CHIP program is known as Healthy Kids, and it includes physician care, dental care, and eye exams, whose families are in that awkward range between not receiving Medicaid or government aid help, but then at the same time not receiving um, medical or health insurance from the workplace, because then children are always at fault and they don't have any control of it. So the government has stepped in to provide them with health insurance so that they don't go unseen. And as said before, that under the Patient Protection and Affordable Care Act of 2010, there is a fee if an individual does not have health insurance. And the main thing is that if an individual can afford health insurance but chooses not to buy it, then they must pay a fee called the Individual Shared Responsibility Payment, and this fee is taken. So then, to focus on the ecological levels of analysis, for the individual, the main focus here is what affects a person's ability to get health insurance, and as said before, it's job and income. A person's job depicts whether or not they could receive full benefits from their job, and full benefits being also including health insurance. However, if they cannot receive health insurance, then obviously their income will then influence whether or not they can receive government aid. And if they cannot receive government aid, then they would have to determine whether or not they are making enough money to afford private health care, or they would have to figure it out from there. In the microsystem, if a family is in poverty, then they might have little to no health care, and this little to no health care influences the health of children, mainly because if a child does not receive care or health care during their years of development, it can greatly affect their development, because they are in need of a physician's treatment to make sure that they are growing and that they are developing well, because if they don't, then they can be at a loss for how to survive in our society. When organizations mainly focuses on the schools, especially elementary and high schools, some colleges as well, because all three of these offer an on-site nurse, and these nurses can be very helpful for students, especially if someone has a common cold or is developing a flu. Then the nurse can take a free examination of the child and determine whether or not what they have is something more serious than something that can be treated at home. And if they believe that it's something serious, then they can help the parents and provide other information on what to do and who to go see. In elementary schools, oftentimes they offer eye exams or scoliosis exams, and this is oftentimes free due to like donations from the physicians, and they do this to help out the community, but also this could depend on the location of the school. For localities, OHSU, which is the Oregon Health Science University, they offer free clinics, but they aren't necessarily free, but they're considered free clinics. And an example of that is the Family Medicine Walk-in Clinic. They offer sliding fees, which is what I was saying, that they aren't completely free, but they're kind of free. But sliding fees are defined as variable prices for products, services, or taxes based on a customer's ability to pay. So what this means is that no one will be denied the care they need due to their inability to pay. So they're able to, an individual, if is able to walk into here and receive whatever medical care that they need, and they won't be denied medical treatment regardless of what they are able to pay. And Walmart also offers a low-cost flu shot clinic, and all you have to pay for this shot is the vaccine itself, and they offer multiple vaccines, not just the flu shot, but that's what they're known for. In a macro system, the main thing here is the government aid, as stated before. They have complete control over who receives the aid, and they have a very set system over who and how you can receive the aid, and they do a very good job of providing as much care as possible for everyone. And then the Patient Protection and Affordable Care Act, also known as Obamacare, um, really was able to benefit the low income and middle income families in providing them the support and um, the support that they needed